Applied Behavior Analysis, ABA, therapy can be effectively implemented at home with proper planning and guidance, often involving behavior technicians who come to your home at specified times to work with your child. The length of the therapy sessions will be determined based on recommended treatment hours. Let's discuss some considerations and steps of ABA therapy in a home setting. Considerations of ABA therapy services at home. Benefits of LeafWings ABA therapy at home for your child with autism. Advantages of ABA therapy at home services for parents. How to get started. ABA therapy at home. Considerations of ABA therapy services at home. ABA therapy at home services provides an invaluable resource for children and families who are looking to benefit from applied behavior analysis, ABA interventions. ABA is a type of therapy that focuses on using positive reinforcement and other behavior modification techniques to achieve desired behavioral changes in children. When considering ABA therapy services at home, there are a few important points to consider. Consultation with a professional. It is advisable to consult with a qualified behavior analyst who has experience and specializes in ABA therapy. They can assess your child's unique needs, develop an individualized treatment plan, and provide the necessary guidance throughout the process. Create a structured environment. It is helpful to establish a structured and organized environment at home to support the progress of therapy. This can include designated areas for different activities, visual schedules, and clear boundaries. However, this can also vary in treatment if the professional you are working with wishes to work on the generalization of therapy by varying the location in your home. That being said, whatever area is used for therapy, that area should be conducive to therapy. Identify goals. Work with the behavior analyst to identify specific target behaviors or skills you want to address through ABA therapy. These can be related to communication, social interaction, daily living skills, or reducing challenging behaviors. Develop a reinforcement system. ABA therapy uses positive reinforcement to encourage desired behaviors. Create a system of rewards or reinforcers that motivate your child. This can include verbal praise, tokens, small treats, or access to preferred activities or toys. Implement teaching procedures. ABA therapy often uses discrete trial training, DTT, or naturalistic teaching strategies to teach new skills. These methods involve breaking down skills into small, manageable steps and providing repeated practice and reinforcement. Treatment consistency. Consistency is crucial in ABA therapy. Implementing the therapy techniques consistently across different caregivers and environments over time will yield the best results. Repetition can be necessary to ensure that a skill is learned and help solidify skills. So your board-certified behavior analyst, BCBA, will ensure regular practice and review sessions are planned for. Data collection. Keep track of your child's progress by collecting data on their behaviors and skill acquisition. Or perhaps your treatment team will also handle this. The data that is collected helps evaluate the effectiveness of the therapy so that the therapy team can make necessary adjustments to the treatment plan as needed. Collaboration and training. Involve other family members or caregivers in the therapy process. For example, grandparents, adult children, and others who have or have had a hand in raising your child. The BCBA will collaborate with those individuals to ensure consistency among everyone and provide them with training on ABA techniques so that they can follow the treatment plan and support your child's progress. Generalization and maintenance. The board-certified behavior analyst, BCBA, and the treatment therapy team will help your child generalize the skills learned during therapy to other settings and situations. For example, the grocery store. The BCBA will develop a plan to practice the learned skills in different contexts and gradually fade prompts and supports to promote independence and maintenance of skills. Ongoing communication with professionals. Regularly communicate with the behavior analyst or therapist to discuss progress, address challenges, and receive guidance. They can provide ongoing support and adjust the therapy plan as needed. Additionally, if you also have your child receiving speech therapy or occupational therapy, all of those professionals should be communicating about therapy. Remember that ABA therapy should be personalized to meet your child's specific needs and should be implemented in a compassionate and supportive manner. The field of ABA is moving to an even more positive treatment approach. Working closely with your ABA professional and maintaining open communication to help ensure the effectiveness and success of ABA therapy your loved one receives at home. Benefits of LeafWings ABA therapy at home for your child with autism. ABA therapy at home, provided by LeafWing Center, offers a variety of benefits for children with autism. ABA, or Applied Behavioral Analysis, is an evidence-based approach to helping children with autism develop essential skills and behavior management techniques. With LeafWings ABA therapy at home program, caregivers can have the support and guidance of an experienced ABA therapist in their own homes. Here are just a few benefits of in-home ABA therapy. Familiar environment. In-home services may be more beneficial for children who struggle in large settings and could benefit from the familiar environment of their home. Meeting the therapy team in a comfortable space can make it easier for some to adapt to therapy and reduce distractions during skill building. Observe daily routines. The behavior technician can gain valuable insight into family systems, dynamics, and routines when they work with your child from home. This understanding of the natural home life can support caregivers in creating goals and building impactful skills for the child and family. Experience personalized support in the comfort of your own home. Behavior technicians can provide care in the home, allowing them to address skills and behavior strategies in the child's real-life settings. Home settings offer more opportunities for training in independent daily living skills and can help children function more independently and generalize those skills quicker than learning in a center. Addressing challenging behaviors that occur exclusively at home. Children may exhibit different behaviors at home compared to daycare or preschool. For example, they might wander or act aggressively only at home. They may also struggle when certain individuals are present, like their dad or grandma. In these cases, offering in-home support allows us to identify the underlying causes and directly address these behaviors. Stronger bonds with loved ones. By serving in the home, technicians can spend more time with siblings and facilitate family interactions to help children strengthen their social skills. An emphasis on behavior intensity. In certain cases, when a child's behaviors are extremely intense and impede progress at the centers, in-home therapy may be a more appropriate choice. This allows the technician to collaborate with caregivers and develop a plan to address the behaviors before focusing on acquiring other skills. Boost motivation. In-home therapy has the benefit of using familiar spaces, toys, and family members as reinforcers. For example, therapists can use backyard play as reinforcement, which is not typically available in a center setting. Additionally, therapists can teach caregivers to understand and use reinforcers as motivators. By coaching caregivers on how to use items at home for reinforcement effectively, it becomes easier for them to increase motivation on their own. Advantages of ABA therapy at home services for parents. Advantages of ABA therapy at home services for parents. ABA therapy programs are effective in providing training to the learner's parent or caregiver. Easier access to caregiver training and coaching. Autism therapy impacts the whole family. LeafWings programs offer caregiver training and family education. Therapists can come into the home and involve caregivers in daily routines. They can also teach strategies for addressing behavioral issues. This helps with relational skills development and success. Convenience. Our in-home service options provide convenient therapy without the need for travel, saving time for our families. This is particularly beneficial for caregivers who work from home. Flexible, tailored hours. LeafWing Center customizes the in-home therapy schedule, considering medical recommendations. They offer comprehensive full-day programs, as well as focused part-time therapy. How to get started. The first step to receiving home-based ABA therapy is to obtain an official autism diagnosis from a healthcare provider. Contact any of our locations to schedule an assessment. Request a behavior consultation. Insurance coverage for ABA therapy. LeafWing Center works with an ever-growing number of insurance providers who cover ABA therapy for the treatment of autism. Here are just a few of the providers with whom we work with. Aetna, Anthem Blue Cross of California, Beacon Health Options, Beacon Health Strategies, Blue Cross Blue Shield of Illinois, Blue Cross Blue Shield of Texas, Blue Cross Blue Shield of Washington, Blue Shield of California, Blue Shield of California Promise Health Plans, Caloptima Direct, Orange Office Only, Cigna, Comprehensive Care Corp., Advanzion Solutions Incorporated, Comprehensive Behavioral Care Incorporated, LA Care, Sherman Oaks Office Only, Magellan, MHN Managed Health Network Incorporated, Molina Healthcare of California, Health Plus, aka Multiplan, Magna Care, aka Multiplan, Managed Health Network Incorporated, aka MHN, Meriton Health, Optum UBH, Optum Health Behavioral Solutions, Pacific Care Behavioral Health, SCS UBH, aka Optum UBH, United Medical Resources, United Healthcare, Winstone Behavioral Health. If your insurance provider is not on the list, we recommend you contact them directly to learn more about their coverage. Please contact LeafWing Center if you have any questions about whether or not your provider offers insurance coverage for ABA therapy to treat autism. After the assessment is complete and your funding source has authorized ABA services, your provider will assign a team for your child. This team will include a supervisor and one or several behavior technicians. Expect to receive a schedule of services before the beginning of each month. Additionally, expect your ABA provider to reach out to you to receive your availability for services and to create a schedule that best fits your loved one's needs. Our team of healthcare professionals assist parents with every step of the process, including insurance verification and creating a weekly therapy schedule. Contact us. Unlock your child's potential. Here at the LeafWing Center, we provide personalized care in the comfort of your own home, allowing us to address crucial skills and behavior strategies within your child's natural environment. From getting dressed to participating in family mealtime, our experts will help your child thrive independently and quickly generalize their newfound abilities. Say goodbye to simulations and hello to real-life progress.